Hello and welcome to this series of videos on managing your back pain in the workplace. My name is Duncan Rock. I'm the physiotherapist at the Sussex Back Pain Clinic and a former sufferer of debilitating back pain myself. It's an absolute pleasure to be here at Pro Fitness Academy, and I'm hoping to use these videos to impart some of the knowledge I've learned being on both sides of the back pain equation, both as a therapist who specializes in back pain, but also as a former sufferer of back pain myself. So, some common back pain myths and misconceptions. In my experience, this is a really good starting place to tackle some of the common back pain myths, which really are quite ubiquitous. There is a fair amount of misinformation out there regarding this topic, and if people start going down the wrong path, it can really make it much more difficult to steer them back in the right direction towards rehabilitation and recovery. In my experience, inoculation against misleading advice can be a very valuable first step in the process of learning how to manage or prevent back pain. So, the first really common myth. While a certain amount of rest is essential, particularly in the acute stages of recovery, to allow tissues to heal, prolonged bed rest actually worsens symptoms and delays recovery. In the vast majority of cases, gentle exercise and movement are usually more beneficial for alleviating pain and promoting healing. The second myth, and this one is absolutely not true. Maintaining a healthy lifestyle can absolutely prevent or minimize the risk of back pain as you age. And I've worked with many patients later in life, in their 60s, 70s, 80s, 90s, who mistakenly thought they were doomed to a lifetime of back pain because of their age, but actually they've learned to manage their back pain very, very effectively. The third myth, back pain will go away on its own and there's no need to seek treatment. While many cases of acute back pain may resolve on their own with rest and self-care measures, ignoring persistent or worsening symptoms can often lead to chronic pain and disability. So in these cases, seeking early help, intervention and treatment can help to prevent acute back pain from becoming a chronic or long-standing problem. The final really common myth, back pain always indicates a serious underlying problem. Now, back pain can be very painful, especially compared to other musculoskeletal injuries. And this often leads people who have experienced back pain to often think that they have had some sort of very serious injury, some very serious structural damage. They think things like, I've slipped a disc, I may have torn muscles, or maybe I've fractured a vertebrae, something really serious. The truth is, most cases of back pain are what we call non-specific back pain, which simply means they're caused by multiple interlocking factors and are not normally caused by some sort of serious structural damage. This represents the majority of back pain cases, and they do improve with conservative measures. Finally, just to introduce this really important concept of an integrated, holistic approach to back pain. Most back pain isn't cured or managed with a click, a pop, or a crack, or a surgeon's knife. Your spine isn't out of alignment, your pelvis isn't out of whack, and you don't need to be constantly manipulated back into place. In most cases, back pain is due to the interplay of three interconnected factors. Some sort of physical factor, you have muscular tension, maybe some joint irritation, maybe some movement dysfunction. That then interplays with some sort of psychological factor. Maybe you're under a lot of stress. Are you experiencing lack of sleep? Are you worried about your back injury? Something like that. Those two factors will interplay with some sort of social factor. This will be the impact of your back pain on your day-to-day life. Is your back pain interfering with your work? Is it interfering with your beloved activities, your social life? Is it interfering with your parental responsibilities? The combination of these factors is what informs the entire back pain experience. And we call this the biopsychosocial model. And it's the management of the interplay of these three factors with a holistic lifestyle approach that has been shown to be the most effective in managing back pain in the vast majority of cases. I hope you found that information useful. In the next video, I want to talk about what it means to have a healthy back lifestyle and a healthy back workspace.